What if I told you there are 5 simple exercises that could help prevent heart attacks and lower your blood pressure? Without a gym, without equipment, and without leaving your home. I'm Dr. Justin Keller. I work with older adults every day who are tired of feeling anxious about their heart health. They want real answers, not another prescription. In this video, I'm going to show you 5 movements that are gentle, safe, and backed by science, especially for those of you over 60. These exercises don't just improve your strength. They calm your nervous system, improve circulation, and protect your heart. You'll learn the best time of day to move to reduce blood pressure, a breathing technique that trains your heart to stay calm under stress, a simple leg lift that boosts circulation and energy, and the one exercise most people skip, but it may be the most important of all. I've seen these work for my own patients. I want you to see the results too. Drop your city in the comments. I'd love to know where you're watching from, and make sure to watch until the very end. The first exercise I'll show you is the one that surprises people most, and it's where I always start with my patients. If you find this video helpful, please hit the like button and subscribe to Glowing Age. That helps me keep making these important lessons available for more people like you. Now let's get started. The foundation, morning march, low-impact cardio. Did you know that just 10 minutes of light walking in the morning can do more for your heart than some medications? I'm not exaggerating. There's compelling research to back it up. For those of you over 60, especially if you're managing high blood pressure or concerned about heart health, this is one of the most overlooked yet powerful tools you have. My name is Dr. Justin Keller. I work with men and women every day who think they need to overhaul their lifestyle to see results. But here's the truth. Big changes often fail. What works is small, consistent action, and the morning march is a perfect example. When you wake up, your blood vessels are tighter, your blood pressure is often at its highest, and your heart is adjusting from hours of stillness. This is when a light cardio movement, like marching in place or walking slowly in your hallway, can ease that transition and protect your cardiovascular system. Let me break it down medically. As we age, our arteries naturally stiffen. That stiffness is one of the key drivers behind rising blood pressure. But studies show that low-impact aerobic movement, just enough to get your heart rate slightly elevated, can increase vascular flexibility. That means your blood vessels respond better to pressure changes. And over time, that helps lower your resting blood pressure. In fact, a study published in the American Journal of Hypertension found that older adults who walked just 20 minutes a day saw significant reductions in both systolic and diastolic blood pressure. But here's the nuance. It wasn't intense walking. It was consistent, it was gentle, and it was daily. The morning march is simple. You don't need to go outside. Just stand tall, march in place at a comfortable pace, and swing your arms slightly to help open your chest and encourage lymphatic flow. If balance is a concern, hold onto the back of a chair or stand near a wall. Set a timer for 5 minutes to start. Gradually work your way up to 10 or even 15 minutes. And don't underestimate this movement just because it seems easy. Light walking stimulates nitric oxide production in the lining of your blood vessels. This helps them expand and contract more effectively, reducing strain on your heart. It also gets blood moving after sleep, when your circulation tends to be slower and clotting risk is slightly higher. What I've seen in my older patients is remarkable. Many of them who started their days this way reported better energy, more mental clarity, and a greater sense of control over their health. One 72-year-old patient of mine started with 3-minute hallway walks every morning. Within 2 months, she was walking outside for 15 minutes a day, her blood pressure dropped 12 points, and she needed less medication under supervision. That's the power of movement that meets your body where it is. So if the idea of a full workout feels overwhelming, don't worry. Start with marching in place. Do it after you brush your teeth, while the coffee's brewing, or even during a favorite morning show. The consistency matters more than the intensity. Every step you take is a signal to your heart. I'm still here, I'm still strong, and I'm still moving. Strength in simplicity, wall push-ups. How do you protect your heart without ever stepping foot in a gym? You train your muscles, especially your upper body, using your own weight safely right at home. And one of the most powerful ways to do that after 60 is something so simple, so low impact, that most people overlook it entirely: the wall push-up. I recommend this every week in my clinic, especially for older adults who need strength, but also need joint protection and blood pressure stability. Here's why: strength training doesn't just build muscle, it actively supports your cardiovascular system. When you strengthen your muscles, especially in your arms and chest, your heart doesn't have to work as hard to circulate blood during everyday movement. That lowers the strain on your heart and helps maintain healthier blood pressure over time. Now, traditional push-ups aren't always realistic for older adults. They put too much stress on the shoulders and wrists, especially if you haven't trained in years. But wall push-ups remove that risk. You're still activating the same core muscle groups: chest, triceps, shoulders, and even the abdominal wall. But you're doing it in a completely controlled, upright position. That means it's not just easier on your joints, it's also safer for your blood pressure. Here's how to do them properly. Stand about an arm's length away from a wall, make sure it's sturdy. Place your hands flat on the wall, shoulder-width apart, fingers pointing up. Keep your body straight from head to heel. Then slowly bend your elbows and lean in toward the wall, keeping your core tight. Pause for just a second, then gently push yourself back to the starting position. Start with 10 repetitions. Do them slowly. Controlled movement is more effective and safer than fast, jerky motion. If 10 feels like too much, start with 5. The goal is consistency, not exhaustion. Now here's what's happening inside your body while you do this. Those muscle contractions help stimulate blood flow, and more importantly, they train your vascular system to adapt to physical effort. Over time, this helps reduce what's called vascular resistance, the pressure your heart has to overcome to push blood through your body. That means lower blood pressure, improved endurance, and better heart rate control under stress. A randomized study in hypertension research showed that older adults who engaged in light resistance training 3 times a week saw improvements in both systolic and diastolic blood pressure after just 8 weeks. Wall push-ups are one of the safest, most accessible ways to achieve that without weights, machines, or strain. Let me tell you a quick story. One of my patients, a retired school principal in her late 60s, had never done a push-up in her life. She told me her arms felt like noodles, and she'd given up on upper body strength. We started with 6 wall push-ups every morning. She did them before breakfast. Within 3 months, she was doing 15 at a time, had improved posture, and her blood pressure dropped 9 points. Most importantly, she felt stronger and more capable walking up the stairs, carrying groceries, even getting up off the couch. This kind of strength isn't just about appearance, it's about independence. It's about building a body that supports the heart instead of depending on it to do all the work. So if you haven't tried wall push-ups yet, give them a chance. They're not flashy, they're not trendy, but they are incredibly effective. Just like the morning march, they're about meeting your body where it is and giving it exactly what it needs to protect the most important muscle of all, your heart. Calm the storm, seated breathing and arm raises, mind-body connection. Have you ever noticed how your heart races when you're anxious, even when you're sitting completely still? That's not just emotion. It's your nervous system signaling your heart, tightening your blood vessels, and spiking your blood pressure. For adults over 60, this response becomes more frequent and harder to control. But here's the good news. With something as gentle as breathing paired with slow arm movement, you can retrain your body and calm the storm inside. This is one of the most overlooked forms of cardiovascular protection. No weights, no strain, just your breath and your awareness. I teach this in every group I lead on managing hypertension through lifestyle because the data is clear. How we breathe directly affects how our blood vessels behave. When you take long, slow breaths, it activates your parasympathetic nervous system, what we call the rest and digest system. This slows your heart rate, relaxes your arteries, and reduces the flow of stress hormones like cortisol and adrenaline. These hormones are major drivers of high blood pressure, especially in older adults. Now, let's pair that breathing with gentle movement. Why? Because your body learns better when multiple systems are involved. When you raise your arms slowly while breathing in and lower them as you breathe out, you're coordinating muscle control, lung expansion, and nervous system regulation all at once. This practice becomes both physical and neurological training, And that combination is exactly what aging hearts and brains need. Here's how to do it. Sit upright in a sturdy chair, feet flat on the floor. Place your hands gently in your lap. Begin by taking a slow breath in through your nose, about 4 seconds. As you do, lift your arms out to the sides and up, like you're drawing a large circle. Then exhale through your mouth for another 4 seconds, slowly bringing your arms back down to your lap. Repeat this for 5 full rounds. Don't rush. The goal isn't speed, it's presence. Studies from institutions like Harvard and Mayo Clinic have shown that even 5 minutes of breath-focused movement each day can lower systolic blood pressure by 5 to 10 points in some older adults. More importantly, it teaches your body how to shift out of a stress state more easily. That's critical, especially when dealing with anxiety, sleep issues, or even grief, which I know are very real parts of life after 60. Let me share something from a patient of mine, a 74-year-old man who had just lost his wife. His blood pressure was creeping higher despite medication. He wasn't eating well. He didn't feel like exercising. But he agreed to do one thing: 5 minutes of seated breathing and arm raises every morning. Within a month, his readings stabilized. He told me, "It's the first time I've felt like I had control over something again." That's what this practice offers, not just a healthier heart, but a steadier life. And for those of you who struggle with chronic tension, tight shoulders, jaw clenching, shallow breaths, this exercise acts like a release valve. You may not even realize how much stress your body is holding until you finally let it go. Don't underestimate the power of simple, mindful movement. It's not just yoga. It's medicine, accessible, immediate, and made for every age. You don't need to be flexible or fit. You just need to be present. Start tomorrow morning. Sit, breathe, and move. That's it. No pressure, just peace. Let your breath lead your body and let that calm wash over your heart. This, right here, is where healing begins. Keep it moving. Gentle leg lifts for circulation. If you've ever felt your legs heavy or swollen after sitting too long, you're not alone. And you're not imagining it. For adults over 60, circulation to the lower body becomes less efficient with age. This is more than just an inconvenience. Poor lower body circulation directly increases your risk for high blood pressure, heart strain, and even dangerous clots. That's why something as simple as daily leg lifts can make a real difference. You don't need a treadmill or a fitness class to get your blood flowing. You just need to activate the large muscle groups in your legs regularly, especially if you spend much of your day sitting. The leg muscles act like a second heart. Every time they contract, they help push blood back up toward your chest. When they don't move, blood can pool, especially in the calves, leading to swelling, pressure buildup, and over time, hypertension. Gentle leg lifts are one of the easiest ways to counteract that. Here's how to do it safely and effectively. Sit on a sturdy chair with your back straight and feet flat on the ground. Slowly extend one leg out in front of you, holding it parallel to the floor for a count of 3. Then lower it back down with control. Alternate legs. Start with 10 repetitions on each side. As you build strength, you can increase to 15 or even add a light ankle weight for resistance. If you're standing and feel stable, you can also try standing leg lifts. Hold onto the back of a chair for balance. Slowly lift one leg out to the side, just a few inches off the ground, keeping your torso straight. Hold for a second, then return. Switch sides. This improves not only circulation, but also hip strength and balance. Research from the Journal of Geriatric Cardiology shows that light leg exercises performed 3 times daily significantly improve venous return in older adults, meaning your body becomes more efficient at moving blood from the lower limbs back to the heart. Better flow equals less pressure, and less pressure means less strain on your arteries and heart muscle. I had a patient, an 80-year-old man with a history of heart failure, who told me he'd stopped walking because he was afraid of falling. But he also noticed his legs felt colder and more swollen. We started him on a seated leg lift routine, 3 sessions a day, just 5 minutes at a time. Within a few weeks, not only did the swelling reduce, but his energy improved, and his blood pressure readings became more stable. That's the circulatory benefit in action. These small exercises also improve something called endothelial function, the health of the inner lining of your blood vessels. When that lining is stimulated by movement, it releases nitric oxide, which helps keep your vessels open and flexible. That's crucial for maintaining a healthy pressure and preventing arterial stiffening, a common cause of high blood pressure in older adults. And let me be clear, these lifts are not about building muscle for appearance. They're about function. The ability to get out of a chair easily, walk to the bathroom confidently, stand in the kitchen and prepare your own meal. Those are all cardiovascular victories. And they start with strong, active legs. So next time you're sitting in front of the television or reading a book, take a moment, just 5 minutes, to move your legs. It doesn't have to be fancy, but it does have to be consistent. You are not too old to improve your circulation. You are not too weak to begin. These gentle leg lifts are an invitation to keep blood moving, to protect your heart, and to keep you steady on your feet and in your life. Balance is blood pressure's best friend. Heel-to-toe walk. Most people don't connect balance with blood pressure, but they should, especially after 60. Because the truth is, poor balance doesn't just increase your risk of falls. It actually forces your cardiovascular system to work harder every time you move. That means more effort, more internal strain, and over time, higher blood pressure. One of the most effective and underrated exercises I recommend to my patients is the heel-to-toe walk. It's simple, it's low impact, and it strengthens the neuromuscular and circulatory systems at the same time. In short, it teaches your body how to move more efficiently with less pressure on the heart. Here's the science. As we age, proprioception, your body's ability to sense position and movement, declines. That makes walking, standing, and even turning more demanding. When your brain senses instability, it signals your heart and muscles to compensate. Your blood vessels constrict, your heart rate spikes, and your blood pressure can rise. This is why people often feel lightheaded or off balance when standing up quickly or walking on uneven ground. Improving balance helps prevent these spikes. It trains the nervous system to respond calmly rather than reactively, and it reduces the physical effort required to perform daily tasks. That's where the heel-to-toe walk comes in. To do it, find a clear hallway or a safe, open space. Stand tall, looking forward. Place one foot directly in front of the other, so the heel of your front foot touches the toes of your back foot. Slowly shift your weight forward, then take another step in the same heel-to-toe pattern. Use a wall or counter for support if needed. Start with 10 steps forward, pause, then walk back. Move slowly and with control. Don't rush. This is a precision exercise, not a race. If your balance feels shaky at first, that's normal. Your body is learning. Over time, your ankles, hips, and core become more coordinated, and your circulatory system adapts to movement without as much internal stress. Clinical studies published in Age and Aging and other geriatric journals have shown that balance training improves cardiovascular efficiency, especially during movement transitions like standing and walking. That means your heart doesn't have to work as hard to keep you upright, stable, and safe. I remember one of my patients, a 69-year-old woman recovering from a mild stroke, who began this simple practice daily in her hallway. At first, she needed both hands on the wall for support. Within a month, she was walking heel-to-toe without assistance. Not only did her confidence soar, but her blood pressure readings dropped steadily. And just as importantly, she hadn't had a single fall or dizzy spell since starting. There's also an emotional side to this. Maintaining your balance isn't just about staying on your feet, it's about holding on to your independence. Every time you strengthen your balance, you're telling your body, I'm still capable. I still trust myself to move through the world. If you're feeling unsteady, start small. Even a few steps a day make a difference. And if you're already stable, adding this to your daily routine, perhaps after a meal or during your morning routine, can reinforce your heart's ability to respond calmly under pressure. We often think of blood pressure as just a number on a cuff. But in reality, it's a reflection of how your entire body, your heart, your nerves, your muscles, works together. Heel-to-toe walking is a gentle, proven way to bring all those systems into harmony. So don't overlook your balance. Train it, strengthen it, trust it. Because when your body moves with grace, your heart follows. These 5 movements may seem simple, but they're powerful. They don't just support your heart. They support your confidence, your independence, and your peace of mind. If you try even one of these this week, you're taking a step toward protecting your heart without adding more medication or stress to your life. I encourage you to go back, rewatch the exercises, and choose one to begin with today. Consistency is what changes lives, not intensity. And if you've made it this far, thank you. That tells me you care about your health and that you're ready to take action, not just for your heart, but for your future. Let me know in the comments which of these you'll try first. I read every one. And don't forget to tell me where you're watching from. I love hearing from you. Please like this video and subscribe to Glowing Age if it helped you. Your support helps me keep creating these simple, practical guides for healthy aging. Take care of your heart, one step at a time.